When you're out in the cold weather, your body's first priority is to maintain its core temperature. In order to do that, the body shifts blood away from the extremities to the heart and lungs. This leaves the fingers, toes, arms, and legs extremely vulnerable to shutdown, known as frostbite. There are 3 different degrees of frostbite. Each is classified by the depth of the frozen cells, very similar to how we classify burns. Frost nip is the first stage or degree of frostbite. The skin begins to turn red and can begin to go numb. As the skin warms, you may feel pain and tingling. However, frost nip does not permanently damage the skin. Superficial frostbite turns the skin from red to white and pale. Ice crystals will begin to form inside the tissue. When warmed, the skin will turn to a bluish purple along with possible fluid-filled blisters. Deep frostbite affects all layers of the skin. The extremity will go completely numb as the ice crystals continue to form deeper and deeper within the tissue. Eventually, the affected area will turn black and hard as the tissue finally dies. This is an example of frost nip. As you can see, there's some slight redness but no blistering or blowing. Here we have a picture of someone suffering from superficial frostbite. As you can see, there are blisters covering their hands and some of the redness is beginning to drain away. This is deep frostbite. Blood circulation has been completely cut off to this extremity, leaving them hardened and black. Once an extremity has been affected by frostbite, you should rewarm it using warm water around 104 to 108 Fahrenheit. As the water cools, continue to add more warm water. Do not pour the water directly on the affected area. If warm water is not available, then what's left of your body heat may be used to help prolong the effects of frostbite. These include warmth from breathing into cupped hands or placing hands in hot spots such as the armpits. When rewarming, do not use direct heat from heating pads, radiators, or fires. Also, do not rub or massage the skin. Both can lead to further damage. After sensation is regained in the affected extremity, dry, sterile bandages should be applied. Also, be sure to separate toes and fingers with cotton balls or gauze if possible. Staying warm and dry are the 2 most important factors in preventing the onset of frostbite. Firstly, a thick waterproof jacket to retain core heat. Secondly, a pair or 2 of thick wool or synthetic socks. And lastly, a hat and gloves. When it comes to frostbite, coverage is key. As long as no skin is exposed and layers of clothing are applied, then generally frostbite will not be an issue.